Okay, so you just finished reading the consent form and watching the consent video for LASIK surgery, and you're a good candidate for surgery. We're going to talk a lot about the risks of surgery because they are really emphasized in the consent. And there's one thing that I think is really good about both the video and the consent form. It's that they give you a ton of information very concisely. What I don't like about those two things is that they don't really give you any perspective. And if all of those risks and all the bad things that can happen have equal frequency and happen a lot, then we shouldn't be doing the surgery. So we're gonna put that into perspective for you. I think that's my job, to talk to you a little bit about the risks of surgery. First thing I want to do though is talk to you about sort of how the day of surgery will go. So you're going to get to the LASIK center. They're going to do some measurements there, and then they're going to put you in a quiet room in a nice, comfortable, relaxing chair, and they give you a little bit of Valium so that you can start to chill out. I expect that Valium just to take the edge off. I don't want you too sedated. I don't want you too loopy. So I want you to be able to sort of listen to me and follow directions. And then what will happen is we'll bring you into the laser room, and both the lasers that I use are in the same room, both to create the flap and to do the treatment. So the first thing we'll do is move you under the laser to create the flaps, and we'll do the flaps in both eyes. And if I'm happy with the way that those flaps went, we'll swing you over the other way, all in the same bed in the same room, to the laser that will do the treatment. I'll take back the flap on one eye, do the treatment, lay that flap back down, and then we'll do the same thing for the other eye. The whole procedure, once we're in the operating room, is going to take under 20 minutes, and your actual laser time will be under a minute for sure. Some of you that are lower degrees of nearsightedness and astigmatism might be as little as 10 or 15 seconds of laser. It's a very fast-acting laser. It does the job really efficiently. And so that means that it's really safe for you to be under that laser. And in fact, the laser has a tracking mechanism on it so that when you're making little movements of your eyes, and everybody does, the laser will actually move with your eye so that we get all the spots from the laser in the places that we want them on your cornea. Once surgery's over, you'll go to another room. They'll put some shields on your eyes. They'll give you a Tylenol 3 as long as you're not allergic to codeine. And the idea here is that the codeine and the Valium will work together to knock you out and let you sleep for a couple hours. The reason we like to do that is that the first couple hours after surgery, there's a lot of stinging and burning and tearing. So if I can get you to sleep through that part of things, it'll be a lot easier for you. And when you wake up, you should notice that your vision's a lot clearer. And in fact, your vision should be good enough the next day to drive yourself to the office for your post-op visit. It's that rapid of a recovery. It won't be perfectly sharp, but you'll be able to tell that you're pretty close to 20/20 that first day. That day, you'll also be very comfortable. I'll see you myself for a post-op visit. We'll go over your eye drops, make sure that you're all set with that. Then we usually do a 1-week post-op, and then maybe a 1-month post-op, and then depending how you're doing, 6 or 8 months after that. When I talk to my patients about the risks of surgery, I like to divide the risks up into common, uncommon, and rare. So let's talk first about common. There's only one common problem that I run into, and that's under and overcorrection. So what that means is that surgery went perfectly. I felt like you were laying nice and still under the laser. The flaps were perfect. But the fact is that some people's corneas are harder and some people's corneas are softer. And so the laser doesn't give us the effect that we expected. When that happens, we usually know that within the first month after surgery. And if we have to, we can put you back into glasses or contact lenses while we wait to make sure that you're stable for surgery. And then we'll do a second surgery probably 3 to 4 months after your initial surgery. Now, I can tell you that that's a very rare occurrence. Depending on your degree of nearsightedness, it's somewhere between 1% and 3% of my patients that I'll have to go back on and do a second surgery. And actually, that second surgery is pretty easy because we can lift the original flap that you had, do your treatment, lay that flap back down, and then you'll be where you need to be. So the idea here is that even though this is something that we consider common at 1 to 3%, and by the way, in the real world, if you told me something was common, I would think it's 75%. So what I'm telling you is that the risk that I think is the most common is actually fairly uncommon and is easy to fix. And in the meantime, we can put you back into glasses and contacts. So it's not really a complication type risk. It's just sort of a bump in the road. By the way, what you're paying for your surgery will cover any retreatments that I need to do. Until we hit the mark and we're happy with your vision, those retreatments are covered by me. Let's go to the other extreme now. Let's talk about the things that are actually very rare. And the reason that I'm happy to talk about those is that the rare things are the really bad things that can happen, the things that can permanently damage your eye. So we're talking about things like infection, scar formation, haze underneath the flap, or damage during the surgery. Now, these are things that have been put at 1 in 250,000 and 1 in a million odds of happening. So really, we're talking about an extreme when we talk about rare. But in spite of that, we're still going to put you on an antibiotic drop and a steroid drop, and those will be to avoid those things from happening. We're not going to wait. We're going to sort of head them off at the pass and make sure that before they even happen, we've treated them. Honestly, I'm not sure I've ever seen a mild infection, let alone one that's progressed to that point. Same with scarring. It's just something that we don't see very often at all. I've had some patients where I thought, well, maybe there's an infection because their eyes are a little more red or they're a little more sore than I thought they would be. We increased the antibiotics. I'm not sure those were really even infections. But the point is that we have that covered by preventatively treating you with the eye drops. And then everything else you read about and saw in the video falls somewhere in between that, 1 to 3% and that 1 in 250,000 to 1 in a million. So we're talking about things like dry eyes, halos in your vision, glare in your vision, difficulty driving at night. These are actually things that are fairly common right after surgery, but usually by the 1 month visit, those things are gone. Glare and halos, have had some experience with those where they don't go away for 6 or 8 months. And I've actually got a small number of patients that have permanent glare and halos. Although if you say to them, tell me about your glare and halos, they'll say, well, yeah, when I get behind the wheel at night to drive, I've definitely got some glare and halos, but it's not stopping me from driving at night. And by the way, I don't wear glasses anymore. So in balance, they have felt that it was worth that little bit of a complication, a little bit of a problem in order to get themselves, less dependent on their glasses. So that's sort of my LASIK talk. What I'm going to do is come back in a few minutes and we can go over any part of this talk that you want. I'm happy to answer any questions that you have. And then Mary Jo will come in and talk to you about scheduling, make sure that you're all set for where and when you're going to go to the LASIK Center. And that's the next time that I'll see you after this discussion today.